Thank you very much for giving a very comprehensive yet concise picture of each area that you were covering. My name is Dr. Chen. Everything you were saying, I am the agitator. When you talk about riotous, we could do that too. And we do it with our shoes on, in all white, in African clothes, in silk, or whatever is required, so that we can reach people in the community. If it means going to the areas where the sex workers are, they get a little nervous and they start to feel like I come to preach to them, but I try to do it in a way that's non-invasive. I never have to shift from my African cultural foundation, because they already kind of they would be a little surprised if I came in like a short pum pum skirt or something like that. You see, the challenge we've gone before legislature, and coming from the US, and I want to make sure I clarify this, the US Virgin Islands, we are marginalized even more than many of the states here, because we're still unincorporated. We're non-self-governing. And we have a lot of issues even trying to have a constitution equivalent to a state constitution. And because of that, when we speak of health issues to our legislative body that has 1 woman out of 15, it is very challenging to be able to produce policy. We have written, we've had the lawyers come together, we've had laypersons, we've had the stakeholders, we've tried to model the various areas we've seen that have some degree of success. It has been overwhelmingly positive what I'm hearing in just this seminar today, because you all are giving me like more feed, so that when I return home, I'm going to make that clear. I really, really, really used to be called. I do it with an air of controversy that's pleasant and more diplomatic. And I say it, when you were saying what you were saying, the people who have been instrumental in helping us have actually been young girls that are willing to, and they get marginalized in our community. So any networking that we can facilitate the development of hair to be able to do that would be well received, because these are young ladies like from 14 to 19, and they are putting their reputation to a certain place. And they've asked that question: if we're willing to do this for the quote-unquote gender-specific work for the girls, what about our brothers? So when I'm hearing young sisters saying that come from, you know, various parts of the Caribbean as well as the US Virgin Islands and here, we're just asked, I think the question is actually to just initiate more networking and collaborations that are more comprehensive. And like I said, the more you guide some of us with the policy parts, just teach us.